Okay. Thank you for joining us today for our webinar, Medicare Made Easy, by guest speaker Heather Rodgers. My name is Annette Eckel, and I'm the marketing coordinator for Longevity Physical Therapy, which has 3 locations in San Diego County. Longevity Physical Therapy is a team of compassionate individuals looking to help you move and live better by addressing your movement challenges, providing excellent and individualized physical therapy and personal training. We strive to deliver clear and concise information to help you live your best in 2022. We will be saving a 15-minute Q&A at the end to answer any questions. During the webinar, you may put them in the chat box and we can address them later at that time. Please join me in welcoming our guest speaker, Heather Rodgers. Heather is owner and agent of HRodgers Insurance Services and is a certified Medicare and life insurance specialist. Heather has been working with Medicare for 25 years. We'll share some great information and we'll be addressing some common questions such as, when and how do I sign up for Medicare? What are the different types of original Medicare? What are the options for Medicare insurance? What are the costs involved? And more. Please join me in welcoming our special guest, Heather Rodgers. It's all yours, Heather.
Thank you, Annette. Good morning. I'm Heather Rodgers, Medicare specialist, and I am so glad you guys were able to join this morning. I'm going to go ahead and start sharing the presentation here. One thing that I want for you to be aware of is that this is presented by United Healthcare. However, I am not necessarily presenting it for United Healthcare. I am an independent broker, which means that I represent all of the carriers. And I'm using this because it does tend to be the best educational presentation. So let me go ahead and get this started. So I'm just trying to line this up here. There we go. So let's go ahead and get started here. And like Annette said, we will be able to answer any of your questions at the end of the presentation. So we'll go ahead and go to what Medicare is and what you need to be in order to get Medicare. You have to be a U.S. citizen or legal resident. If you move here, you do have to live in the United States for at least 5 years in a row, including the 5 years just prior to applying for Medicare. You also need to be 65 years or older. However, those who are on disability for 24 months are eligible for Medicare under the age of 65. Also, anyone with end-stage renal disease or ALS. You are going to be able to enroll in these if you meet those qualifications. Medicare is not Medicaid. Medicaid is a state-run program, and Medicaid is based on financial resources, whereas Medicare is an entitlement program that everyone has paid into and is getting for medical care at a certain age. So when you are eligible for Medicare at age 65, there's a 7-month initial enrollment period. It includes the 3 months before you turn 65, the month of your birthday, and the 3 months after. So you have that initial enrollment period. It is best if you go ahead and sign up early so that you don't wait, especially if you need it to start on your 65th birthday. Social Security does take a bit of time, and I like to have people go ahead and apply as soon as they can for their Part B the first day of the month that is 3 months before their birthday month. And we'll talk about that a little bit further as we go on. You may stay on your Medicare if you are working. You can stay on your employer insurance if you are working past the age of 65. The way to do that is if your employer has 20 or more employees and the insurance is considered creditable coverage. How you find that out is you have to talk to your human resources to ensure that it's considered creditable coverage. The employer doesn't require covered spouses to enroll in Medicare at age 65 in order to remain on the employer's plan. It's important to know that you must stop contributing to a health savings account once you enroll in Part A or Part B. And you can still use the money you had in your health savings account, but you can't continue to accrue money in that and save money to that. At the bottom here, like I said, you will be automatically enrolled in Medicare Parts A and B after your 24th month of disability, and you still have a 7-month initial enrollment period. So you can stay with original Medicare, which is A and B, and this helps pay for doctor visits and hospital stays, but it doesn't cover everything. You can also, on top of having A and B, which is your original Medicare, you want to add on a prescription drug plan, which is Part D, and you can add on a Medicare supplement, which is where you keep your original Medicare and then pay for a supplement plan as well. Or you can do a Medicare Part C, which is called a Medicare Advantage plan. That is where they combine your Part A and Part B, and they also embed a Part D. So you do not have to have a separate prescription drug plan if you go with a Medicare Advantage plan. The first thing you need to do is enroll in original Medicare, which is where you get Part A and Part B. Then, like we just talked about, I am going to be repetitious in this a bit because it is a little bit confusing and there's quite a bit of information when you first learn about it. Once you get Part A and Part B, you can then get a Part D, a Medicare Insurance plan, supplement plan, which is called Medigap. You can also get a Medicare Advantage plan, which usually most of them do include a prescription drug plan, which is embedded in there. If you are on limited resources, you can get help from Medicaid in the state of California. It's called Medi-Cal. If you're fully eligible for Medi-Cal and you have Medicare, you do not pay for the Part B premium, and pretty much all of your costs are covered. If people do not qualify for full Medicaid or Medi-Cal, then they have variations of that called extra help, which pays for the drugs and the deductibles and copays on your drug plan. If you want to learn more about the financial assistance programs, you can visit medicare.gov. You can also talk to me because I can provide that information to you. Medicare Part A covers hospital part. So there's A and B. A covers the hospital portion. It covers a semi-private room, your hospital meals, your nursing services while you're in the hospital, intensive care or special units in the hospital, all of your drugs, supplies during inpatient, your diagnostic tests, operating room services, blood transfusion, anything that you would get while you're in the hospital is covered under Part A, except for the doctor's visits, actually. That is covered under Part B. But everything else while you're in the hospital is covered under Part A. Part A, if you have worked for the equivalent of 10 full-time years or 40 quarters, you don't pay any premium per month on that. Folks who haven't paid into the system for long enough can pay up to $499 a month just for their Part A. That does not apply to too many people. If you've grown up here and you've worked or your spouse has worked, you're going to be fully qualified with this 10 years or 40 quarters. The Part A, if you don't sign up for a Medicare Advantage or a supplement plan for this year, you have a deductible every time you go into the hospital of $1,556 per benefit period, meaning not just for the year, but every time you go into the hospital. So if you go in multiple times, you're stuck with this bill, even if it's for 1 or 2 days. Okay, so just remember that when you're on original Medicare, you definitely are going to have a lot of excess costs coming out of your pocket. It also pays for $0 for the first 60 days as long as you pay this deductible, and so on and so forth. This is the breakdown. Skilled nursing facility is nothing on any plan for Medicare or original Medicare the first 20 days. Medicare Part B covers all outpatient medical care. So for example, your doctor visits, like I said, including in the hospital, your annual wellness visits, anything you get in an ambulatory surgical center, ambulance and emergency room services, skilled nursing services, any of your preventative shots like flu or mammograms. And we have now, they're adding shingles onto being covered under Part B Medicare, which is, they should have been doing that all along, but now they're finally doing it. Clinical laboratory tests and services, x-rays, MRIs, some health programs. You've got physical therapy. So here at Longevity, your outpatient physical therapy is covered up to 80% under original Part B Medicare. Diabetes screening, mental health care, durable medical equipment for use at home like wheelchairs and walkers, that's all under Part B. The other thing I want you guys to know is that you are going to have access to this, and that's going to be mailing this out along with my information. So this is not going to be the last time you'll be able to see this. And again, any questions you have, I'm here to answer them for you. So don't feel like if you're not getting all of this right now. It's a lot of information. Part B cost for original Medicare for this year, the Part B premium is $170.10 a month if your income is of a certain amount. And that's where I'm actually going to share something else with you here. So give me 1 second while I get out of this and go to my IRMA screen. Hold on. Annette, can you see my screen?
Not at the moment.
Okay, hold on 1 second. Okay, can you see it now?
Yes.
Okay, great. So I want to make sure that everyone understands that there is something called an IRMA. It stands for Income Related Modified Adjusted Amount. Of course, leave it up to the government to make the longest acronym possible. So if you look at this, and I can also provide this as well, this shows the breakdown. It's a floating 2-year period. So whatever your income was 2 years ago is what they base the IRMA on. And it is not all your income, it is your modified adjusted income. So that's really important to know. If you look here for an individual, $91,000 or less, then they pay the basic $170. However, for an individual above and beyond that, up to $114, it jumps up to $238. For an individual $142, it jumps up to $340, and so on and so forth. So as you see, it's important to know what your Medicare premiums might be, and the more money that you are making in your modified adjusted gross income, that's what you're going to be paying on this. It is important to know also that any money that's put into a Roth IRA is not considered in this income bracket. So that's very important. So talk to your financial advisor about this, or your tax accountant. Because the monies that are coming out of a Roth that were contributed to a Roth do not apply to this, which can significantly lower the amount that you're going to pay on your Part B premium. Again, if you're on Medi-Cal, you don't pay any premium. But if you're not, and you're making these amounts under this schedule, and this is just for the year of 2022, and it changes every year. And they're also not just a Part B premium, there's a Part D premium. They're going to get you coming and going. So on this right here, as you can see, it's not as much, but it's the same numbers here. But on your Medicare Part D plan, this is what you would add to your premium. So let's say that you're on a Medicare Advantage plan, which most of those have your embedded prescription drug plan. So you wouldn't be paying any premium on that. You would still, if you're making these amounts of money, you would still have to add on this every month. And these dollar amounts that I'm showing you here, they're not going to the carrier. These are going directly to the federal government, okay? So these amounts right here that you're seeing, those are not to the carrier, they're to the government. And those can be taken out of Social Security if you're already claiming Social Security. So again, I'm going to send that out to you whenever we're done here. And let me go back to another share. Hold on one second. About that, give me one second. Go. Sorry about that. Okay. And Annette, can you see my screen now?
No, not yet.
Okay. How about now?
Yep.
Okay, great. So I just wanted to go out and show you guys about this number right here, because that's, this all comes down to what are the costs going to be and what is the coverage you're going to get. And there's a lot of extras, believe me, especially in the Medicare Advantage plans that are wonderful, but it's very important for people to understand how much they're going to be paying each month just for your basic Medicare, your A and B, which you have to sign up for a plan. So for the year of 2022, that's the standard premium. You have a $233 a year deductible. And what this does is it covers all of the co-insurances and co-pays that the original Medicare does not cover. I'm so sorry, I misspoke. You will also still have a co-insurance of 20% on original Medicare. So that is why people will sign up for a plan on top of having original Medicare. It's important to know you also have penalties that go along with this. So for every month that you should have been on your Part A or Part B, you get a 10% penalty. So let's say that you missed 10% of your Part B premium, and that is for a 12-month full period is delayed, and you delayed that for 3 years. You were thinking, you know what, I don't need to sign up for Part B because I'm on my employer insurance, or I'm on COBRA. A lot of people think I'm on COBRA, I don't need to sign up, or I just don't want to sign up. The government doesn't care about that. If you didn't have creditable coverage and you were past the age of 65, you will start accruing this 10% premium for every 12-month period. So now you're going to be getting a 30% penalty on top of your Part B premium. So they really look at that and they will know. So you have to make sure that you are not missing out on when you're supposed to sign up for that. And don't assume that you think you are covered. You definitely want to check with somebody like myself, your HR, cover all your bases if you decide you don't want to sign up when you're 65. So original Medicare Parts A and B, they do not cover basic things like if you go outside the United States, personal expenses while you're hospitalized, believe it or not, such as a TB, custodial care, doesn't cover long-term care, days spent in a psychiatric hospital beyond a certain limit, hospital days beyond a certain limit. You don't have eye coverage or hearing coverage under routine original Medicare. You don't have routine dental, some prescriptions and wellness benefits. A lot of these things are covered under the Medicare Advantage plan, and some is covered under the supplement. So Part C now is where we have our first option for signing up for an insurance plan. Medicare Advantage is basically always an HMO or a PPO. Here in San Diego, it's generally an HMO. There's used to be just one PPO plan. Now I think there's two for the Medicare Advantage plan. These typically include Part D prescription coverage, hearing aids, routine dental care, eye exams, wellness benefits, transportation, personal emergency response system, meals when you come home from the hospital. There are so many bells and whistles with these plans because we live in a very populated area. So these plans are very competitive. And I always tell people to at least talk about the options for a Medicare Advantage plan, especially since we have access to such excellent health care here in San Diego. So that's your Medicare Advantage Part C plan. The premiums are often free. Here in San Diego, they're pretty much all no charge for that. No charge for the monthly premium, no charge for the embedded prescription drug plan. So we can talk about, if you want to talk about specific items of each plan, we can whenever you get to, if you're interested in a Medicare Advantage plan. Co-pays, plan premiums, deductibles, co-insurances, they're all going to vary on where you want to go for your doctor, what network you want to be in, and what services you're looking for. So instead of reading through this, it would just depend on your specific individual needs and which plan and network you decided to go with. Okay, that's what we talked about there. Remember that with a Medicare Advantage plan, if it is an HMO, you do need a referral. Okay, you do need a referral and pre-authorization. It is in a network. Okay, preferred provider plans, it is still a network, but you don't have to have a referral. You are going to pay extra costs, though, typically 40 to 60% if you go outside of that PPO plan. That's why I tell people here usually, hey, if you don't want to do the Medicare Advantage plan, instead of doing a PPO where you will be paying a premium, you might want to just look at the Medicare supplement plan. Those are different types. Special needs plans is for people who have chronic diseases or for dual eligible. So dual eligible is becoming more and more common, and that's for people who are Medi-Medi, who are on Medicare and Medicaid. And there's some really amazing high quality plans for that, for those people. Okay, now we're going to talk about Medicare Part D. And like I said, that there's a formulary for these, and I'm going to show you how this breaks down. There's 6 tiers, and that decides tier 1 is the least expensive, tier 6 is the most expensive. And the plans typically do not cover the drugs if they're not on the formulary, and then certain other prescription medication, fertility, erectile dysfunction, and of course, no cosmetic purposes. Non-prescription drugs are not covered under Part D, but a lot of these plans have over-the-counter benefits of like up to $120 a month. I mean, a quarter, $120 a quarter. Okay, let's keep going here. These are just some of the areas that you want to be aware of for your Part D plans. Standalone Part D plans, they're all going to have a premium. The least expensive plan here in San Diego is the Aetna SilverScripts Smart RX, which is $7.50 a month. That's if you have no medications or if you have very few inexpensive medications. But I do a research on your meds to find out which plan is the best for you cost-wise. There is a deductible. A lot of the plans have a $480 deductible a year, but remember, it doesn't mean you have to pay that $480 before any of your medications start getting paid. It just means it's broken down in different ways so that you're paying a portion, but some of it's also a deductible, like a copay or something like that. And then you have copays and co-insurances. So we have tier 1, tier 2, tier 3, tier 4, tier 5. There's actually a tier 6 as well that's even more expensive than that. And again, the cost is going to be impacted by what type of drugs and how many you're taking. I know that injections, chemotherapy drugs, some of the diabetic medications, Eliquis can be more pricey. This is very important to understand about your coverage cycle that usually starts on January 1st. You start in your annual deductible. You pay for your drugs until you reach your plan's deductible. So some people, if they're on not very expensive drugs, they just stay in this portion here. They're paying $3 or $4 per drug each time they fill them up, and not much. However, some of those people that I was just talking about, where they are on Eliquis or some diabetic injectable medication, different things like that, they pay a copay or co-insurance until they get into where you, the manufacturer and the insurance company reaches $4,430 for the year of 2022. They haven't given us the new numbers yet. Once everybody that's paid in reaches that amount, you now go into the coverage gap of the donut hole, and that's where things can really get expensive. So some people are on drugs like Ozempic, where they're paying, $400 a month for it when they enter this coverage gap, and you are paying 25% for both brand name and generic drugs until you reach $7,050, and then you go out of the coverage gap into the catastrophic phase, and then you're just paying barely anything. But you do have to get to that 7,050. Okay. Sometimes I tell people to use this until you get to almost this amount, and you're going to go in here, and then you could look at things like GoodRx. There's nifty ways to look at it to see if you can save money on these things. So again, another late enrollment fee. If a lot of you say, I don't take any drugs, I don't need a prescription drug plan. Everybody has to sign up for a prescription drug plan according to the government, even if you don't take drugs, because insurance isn't for when you need it, it's paying even when you don't need it. So it's there when you do need it. So the 1% premium is per month. So for every month that you should have signed up for your Part D prescription drug plan and you didn't, there's a 1% charge that adds up, and it never goes away. That's there permanently. So let's say you go 18 months and you have an 18% penalty. That never goes away. That 18% penalty is based on what the national average cost of drug plan is. And for right now, it's about $33 a month. So you would have 18% added on to that $33, and that would be added on to your monthly drug premium, and it never goes away. So you have 63 days after losing your creditable drug coverage, which is usually from an employer health plan, to sign up for this. Not long at all. So basically they're saying when you no longer have creditable coverage, you need to get signed up for a prescription drug plan. So now we're just going to talk about the Medicare supplement insurance. And with the Medicare supplement insurance, you are keeping your A and B, which is your original Medicare, and you're adding on another plan, which is always has a premium to it. And what this does is that there's no pre-authorization, there's no referral needed. You can go anywhere in the United States, as long as, this is the main thing, as long as the provider accepts Medicare, so that they would be billing Medicare, and then any of the excess charges that's not covered by Medicare, they get paid by the supplement plan. Okay. They do also pay for things like foreign travel up to the plan limits, and there's some great things that go along with this. Some Medigap supplements, they do include some vision and hearing. Most of them include a free or discounted gym memberships, but they are absolutely not going to have all the bells and whistles that a Medicare Advantage HMO plan has. So this is a little bit difficult to tell because this is a pamphlet. And so I'm going to show you this page and all of these things, just so you're aware that these are the things that different ones will pay. And then this is what the other page looks like. So they would be lined up right next to each other, but unfortunately in this mode, we can't see that. What I typically recommend for most people is the Plan G. That's a very good plan. It's the most economical for the cost. What I do want to point out is that these plans are not available. The F plan is not available for people who were eligible for Medicare after January 1st of 2020. And what I also tell people is, even if they are on Plan F, what I find is that you're paying extra for this premium, and that it does pay for your $233 deductible. But if you look at the cost of these premiums under Plan G, you actually have a cost savings most of the time by being on a Plan G. So if you are on the supplement, I'd be happy to look at that to see if there would be some cost savings, because these plans are all standardized. They're all standardized. They all have to pay, the same amounts, as long as, like Plan G, it's all under there. The only thing that's not there is that deductible that you see right here. Okay. Again, It's up to individual people. And that's when I do a needs analysis with each person to find out what their specific situation is. What is your financial situation? What is your medication situation? What is your health situation? What is your comfort level? Everybody's different. So I don't want to sit here and say that one is better than the other. It really comes down to each person's individual needs and their choices. And that's what I do is I help them come to that decision. This is a really big page that basically goes over everything we just talked about. It talks about when you can enroll in each of these, what you're paying for your premium, about the prescription drug coverage that most are embedded in here, but these you have to get it on the supplement, you have to get a separate standalone plan. Medicare Advantages, you have a network. Under the supplement, you don't. Again, you're in a network under the Medicare Advantage and not on the supplement. And on the Medicare Advantage, pretty much unless you're on a PPO, you will need to have a referral. On the supplement, you will not. Okay. And again, you're going to be getting all of this to look at. So how do you begin to narrow your choices and how do you decide which one is right for you? Talk to me. We can figure that out. Let's talk briefly about your enrollment periods. Your initial enrollment period, whenever you are turning 65 or going off your employer coverage again, is the 3 months prior, the month of, and the 3 months after your 65th birthday. Okay. A general enrollment period is if you did not get signed up during this time, you then have to wait. And the general enrollment period then happens every January 1st to March 31st, and then would be effective on July 1st. And remember, you're going to get a penalty. So if you did not sign up during your initial enrollment period, and you should have, this is when you get to sign up, but it won't be effective until July 1st. So all of those months, there will be a penalty there. This just kind of breaks down, the special enrollment periods again. And if you are working and you decide to come off of your employer coverage, you have 8 months actually to enroll in Part A and B for the medical. Okay, for the medical. But remember, for the Part D prescription drug plan, you only have 63 days. So if you want to go on a Medicare Advantage plan where the prescription drug plan is embedded in that, then you would sign up for everything within the 63 days. There's also special enrollment periods. So if you move or you're losing your COBRA coverage, you also have what's called a special enrollment period, which gives you a qualifying event. And it is 2 full months after that qualifying event is usually when that happens. So if anybody is moving out of the area and they need help in a different area, even different states, I help people when they move to different states all the time, or somebody that's moving into the area, I can certainly help them with that. And they have a special enrollment period. We also have special enrollment periods with FEMA. And we have special enrollment periods for people who are on Medi-Cal. They have a one-time chance to change every three months. We have this coming up right now, which I'm sure you guys have all heard about from all the commercials and everything else. This is your Medicare annual enrollment period, which is from October 15 through December 7. And this basically allows everyone who's already on Medicare to make changes. You can make as many changes as you want during this time. And then it becomes effective on January 1st. And that's for Medicare Advantage plans. You also have a Medicare Advantage open enrollment, which if you're already on Medicare Advantage, you have from January 1st through March 31st to make a one-time change again during that time. And then it would be effective the following month after you signed up. On April 1st, no more changes unless there's a special enrollment period like FEMA, moving, different things like that. So there is a little bit of wiggle room on that. Okay, again, we have original Medicare, which is parts A and B. We have HMO, which is parts A and B and D. You have your supplement option, which you have to have part A and B, and then you add on a supplement. And then if you do add on a supplement, you always want to add on a prescription drug plan as well. How to enroll, here's numbers for A and B. I can also help you with that and make it much easier for you. But it depends on what your situation is. If you're already receiving your Social Security benefits, you're going to be automatically enrolled in the parts A and B. But we just want to talk about that to make double sure. If you are not enrolled in Social Security, then you have to actually manually go in and sign up with that through the Social Security office. And you can decide and you can choose which date you want it to be active, because remember, once you sign up and that becomes effective, you have to start paying that Part B premium every month. So these are just some scenarios right here that are included, but let me ask Annette how we're doing on time.
We're doing good on time, so you can review a couple of examples.
Okay, let's do that. So who are we gonna meet first here? We're gonna meet David. So David chose a Medicare Advantage plan with a built-in prescription drug coverage, which is your typical straightforward. He just turned 65 and he took good care of himself and he takes very little drugs and things like that. So remember that his costs are, because he's not on Medi-Cal and it looks like he's on that first tier of income, he's paying $170 a month for his Part B premium. He's paying nothing for his Part C premium. And then the prescription drug is embedded in this. But for his copays, because he barely has any medications, he's paying about $15. So for David, he's paying $185.10 out of his pocket a month, which really is not that much. Now, if he goes to the doctor, there might be copays or there might not be, depending on what plan he decides to use. But he's also getting like fitness programs and dental and hearing and just amazing amount money back. Some plans give back $150 a month back to your Part B premium. It's like they're paying, and over-the-counter credit that you can spend on over-the-counter supplies. Then the next person here is Juanita. She will be 65 in 3 months and plans to retire at that time. She then plans on spending time traveling from her home in Colorado to visit family in California. She is in good health and she takes 2 prescriptions. So what she has decided to do, because she's going back and forth between the 2 places, even though she doesn't necessarily have to do this, because if she needed to use the urgent care or the emergency room, that is covered under a Medicare Advantage plan. But because she's going back and forth, or let's say somebody who wants to access UCLA, or if they're here in San Diego and they want to access Scripps and Sharp or UCSD and have different doctors from different places, that would be somebody who would want to do a supplement plan. So for her, she of course always has to pay the $170, then she has to add on a drug plan. And for her, she's paying $34 a month, which seems very high for a osteoporosis and cholesterol drug medication. So I'm not sure what plan that would be. And then she's paying about $150 a month for her Plan G premium. And that seems a little bit high too for 65. And then she's paying about $10 in prescription copays. Now remember, she's only paying $36,410, which is more than David was, but she knows exactly how much she's going to be spending, because when she's on a supplement, she doesn't have any copays or coinsurances. Anytime she uses medical care, as long as Medicare is accepted by that provider, she doesn't have any extra costs because that's included in her supplement. So there's different things here that you can look at that will give you a breakdown of, okay, so Georgia just decided to stay with her original Medicare, which again, I do not recommend, but she's paying the $170 a month. And then she's paying a $34 Part D premium because she had to add on her prescription drug plan, right? No matter what. And her drugs are $10 a month. So she's paying $214.10. If she would have gone on to a Medicare Advantage plan, she would even be paying less than that and getting many more benefits than what she's getting. But again, everybody's preference. All right, so I'll let you guys look at that at a different time. Matt did not add on a prescription drug plan, which is going to be a problem for him. Neither did Karen. She's just paying her $170 a month. She needs to add on a prescription drug plan. Okay, so those are your some examples for you that you can look at. And let's see here, what else we want to look at. Okay, if you do need help paying for Medicare, again, there are definitely programs, even if people don't fully qualify for Medi-Cal. There are more and more people qualifying for Medi-Cal these days, but there are partial eligible that can help pay for drugs or different things like that. So don't ever feel like you can't ask to see if you qualify for that. Here's some numbers for you. You can call Social Security, Medicare, Medicare.gov online. These people can ask you about buying insurance and choosing a health plan. I can also do that. That's what I do for my job here. And I think that is pretty much where we're at right now. It has some other numbers there. So why don't we go ahead and open it up to any questions that people have.
Okay, that sounds great. Thank you so much for that great presentation. I'm going to stop recording now, and then we can open up for questions and answers.
Great.
So let me stop.